So there it is. Should be all set.
So what do I
just talk?
Hello? Welcome everyone to Colorado School of Public Health special event. I'm very pleased to introduce Dr. Jessica Barrington Trimis. Dr. Barrington Trimis is an assistant professor of preventive medicine and an epidemiologist at the University of Southern California. She's the founding director of the USC Epidemiology of Substance Use Research Group as part of the USC Institute for Addiction Science and USC Tobacco Center of Regulatory Science. Dr. Barrington Trimis' research focuses on investigation of the rapidly changing tobacco, alternative tobacco, and cannabis landscape. Her work aims to identify the psychological, behavioral, and social processes associated with nicotine and cannabis product use in adolescence and early adulthood. And I'm very excited to hear what she has to present today on smoke and mirrors, understanding the role of e-cigarettes in the public health of our youth. Dr. Barrington Trimis.
Thank you, and thank you all so much for having me here. I am quite excited to be here, and coming to you live from Colorado. So let's go ahead and get started. So brief agenda for today. I'm going to start by talking a little bit about youth vaping over the last decade. I'll talk a little bit about why youth begin vaping, why youth continue vaping, some of the adverse consequences of youth vaping that we should worry about, what we can do to protect youth, and I'll conclude with a little introduction into some of the evolution of nicotine products and new products that are coming to the market. So most of my research is supported by grants from NIH, both from the National Cancer Institute and the National Institute on Drug Abuse, as well as the Tobacco-Related Disease Research Program. All right, so when we talk about e-cigarettes, it's always lately seems to be quite a controversial topic. On the one hand, when we think about e-cigarettes and youth, we really don't want young people to be using e-cigarettes, especially people who have never used other forms of tobacco or other forms of nicotine. On the other hand, if we have adult smokers who can effectively quit smoking cigarettes by switching to e-cigarettes, that maybe is not necessarily a bad thing and could even be good for public health. So we're here with this balance. What do we do with e-cigarettes? Do we encourage their youth, knowing that that's going to mean a lot of young people begin using e-cigarettes, or do we discourage their youth, which may mean that some people who might have otherwise used these products as a cessation aid will no longer do so? Most of my research really focuses on young people, so I'm going to kind of just focus on that side of this scale and thinking about how e-cigarettes and how they're impacting young people. All right, so the old tobacco landscape was easy, right? There were cigarettes were the primary tobacco product on the market. People began smoking, and then they suffered some sort of tobacco-related disease. But now this marketplace, this landscape is a lot more complicated. In addition to cigarettes, we now need to think about nicotine use, knowing that there are a lot of different types of products that may have different impact on tobacco-related disease. So big cigars, of course, have been around for a long time. Little cigars, which come in flavors, hookah, smokeless tobacco, snus, vaping products, new salted nicotine vaping products, which I'll talk in a little bit more detail in a moment, synthetic nicotine vapes, which are quite new to the market, IQOS, nicotine pouches, also new to the market, and nicotine gums and lozenges, which have been around for a while, but there's sort of a new generation of these products that may also be appealing to young people. So as I mentioned, I'm really going to focus on nicotine vapes and vaping products. today in my talk and not talk too much about the rest of these things. So back in 2011 was the first year that e-cigarettes were really surveyed nationally. These are data from the National Youth Tobacco Survey among high school students, looking at the prevalence of past 30-day e-cigarette use. In 2011, you can see it was not many who had reported use in the past 30 days. And this increased quite drastically in 2014, where we had a prevalence of almost 15%. At the same time, in 2011, we had about 17% of youth using cigarettes in the past 30 days. And that decreased from 2011 to 2014, where the prevalence of past 30-day cigarette use was less than 10%. So when these initial data came out, there was a lot of optimism in the public health community. There was, a lot of the thought was, well, are e-cigarettes just replacing cigarettes? If e-cigarettes are safer and healthier and not as dangerous as cigarettes, and they're just replacing cigarettes, that would definitely be a good thing. But this concern was quickly replaced by other concerns about whether e-cigarettes may be drawing in new youth who wouldn't otherwise have smoked and who would never have used combustible tobacco products. So trends continued. There was a little bit of a dip in 2016, 2017, and then e-cigarette use, the prevalence of e-cigarette use sort of peaked in 2019, although we don't know what is going to happen from here on out. At the same time, the prevalence of cigarette use continued to decline over time. It flattened out a little bit in the from about 2014 to 2018 or so, but we saw some additional declines in 2020. So one thought that we had kind of early on was in trying to think about how we could get at this question of who is using e-cigarettes. Are e-cigarettes being used by people who otherwise would have used cigarettes, or are e-cigarettes being used by people who otherwise wouldn't have used any combustible product? And so one way that we thought obviously this is a very challenging question, and we don't have a world in which e-cigarettes don't exist to kind of figure out what would have happened and what these people would have done were e-cigarettes not around. But one thing that we were thinking about is, well, if e-cigarettes are just being used as a replacement for cigarettes, then the total prevalence of tobacco product use shouldn't change too much over time. It should remain essentially stable, where we're just seeing sort of some substitution here. And so we looked at the overall prevalence of any tobacco product use. This is, again, still from the National Youth Tobacco Survey. You can see it goes down a little bit from 2011 to 2013, goes up in 2014, 2015, and then is a little bit all over the place after that, kind of reflecting what is happening with the ups and downs with e-cigarette use. In our study, we really wanted to test this theory, right? So as I mentioned, if there were no e-cigarettes around, what we might expect in terms of cigarette use or total nicotine use over time might be a decline from 1995 to 2004, which is what we saw in our data. And then maybe a little bit of a decline from there, but maybe a leveling off as we hit sort of a floor effect in terms of how low the prevalence of cigarette smoking could go. In theory, if e-cigarettes were simply replacing cigarettes, you might see something that would look like this, where you would have that total bar wouldn't be any higher than if there weren't e-cigarettes. It just would be replaced with some people who were using e-cigarettes only, some people who are dual using, and some people who were using cigarettes only. Instead, what we found is that the total amount of cigarette or e-cigarette use was in fact substantially higher. The total rate of use was about the same as it was in 2002. And so the conclusion that we came to from this is that e-cigarettes appear to be bringing in at least some new people who otherwise would not have used combustible cigarettes. We looked at this in national data extending a little bit beyond 2018, or beyond 2014, all the way to 2018, with the same basic idea. So what would we have expected to happen if e-cigarettes were not around? And then, you know, what actually happened. So if e-cigarettes were not around and things just sort of continued the way that they were going, we might expect to see the prevalence of any product use in 2018 around 10%. Instead, we see that the total amount of cigarette smoking is decreased. But when you add e-cigarettes into this mix, you get the same story pretty much. So the total prevalence of any use is higher in 2018 and in many of the years prior to that than it was almost a decade earlier. So this told us really that e-cigarettes are bringing in new youth to tobacco product use, youth who otherwise wouldn't have smoked combustible cigarettes. So the next question then, why do youth begin vaping? To understand the answer to that question, I think we need to spend just a minute talking about the evolution of e-cigarettes. So back in 2007, e-cigarettes looked like cig-alikes. They were intended to kind of mimic what a cigarette looked like. And these were really not good delivery systems. They delivered low levels of nicotine, not very efficiently. And so they were really just a terrible replacement for cigarettes. From there was an evolution to kind of get away from a product that looked like a cigarette to something that looked completely unlike a cigarette. Vape pens came around in about 2009. Mods and box mods were a product that really allowed you to totally customize your experience. You could customize the battery, the atomizer, the color. And then in 2015, Juul came around. And Juul was notable for the fact that they used a different type of nicotine formulation. They used what I'll refer to as a salted nicotine formulation. The big difference between salted nicotine and unsalted nicotine is that the salted nicotine formulations allow for very, very high levels of nicotine without many of the aversive effects that you would ordinarily have at high levels. Juul was followed by other pod mod products and then by other disposable products, which in addition to also delivering very high levels of salted nicotine, were also very cheap. And more recently in 2020, Puff Bar and some other brands have come out with a synthetic nicotine product. And this, again, very similar to what many of the other products, the other recent products are like in terms of their nicotine delivery, but with the potential to escape a lot of the regulation. And I'll talk about that in a little bit. Flavors are, of course, a key reason why young people use e-cigarettes. As I'm sure you all are aware, e-cigarettes are generally available in a lot of different flavors. We did a qualitative study of young people, young adults between the ages of 18 and 25. And throughout this presentation, I'll just share with you some quotes from people who were in our study and talking about why they started vaping, why they started smoking, and some other things. So this person said, I just like the flavors. It's the flavors and the cool tricks you can do. But then I felt the head change. I kind of like that. In a study that we published last year, we looked at the Juul flavors that were used and preferred. This was around the time when the FDA was thinking about prohibiting the sale of all flavored products except for mint and menthol. Our paper came out showing that mint was the most popular flavor among 10th grade students and 12th grade students in the Monitoring the Future study. And it was not long after our paper came out that Juul decided to pull mint from the market and just keep menthol in their tobacco flavor. It's worth noting that this is a little bit outdated, and the study, the market is constantly changing. We recently had a paper that will be published in Tobacco Control, where we were looking at the types of flavors that young people were using, and nearly half of young adults reported that they were using an ice flavor most frequently in the past month. With fewer percentages reporting use of fruit or sweet flavors or mint or menthol. And these ice flavors are notable because it's really a combination of a sweet or a fruit type flavor with some sort of cooling agent, so menthol or other chemicals that sort of act similarly to menthol. Social influences, of course, have always played a role. This person said it started as a social thing, then branched into an addiction, and goes on to talk about how they had their first e-cigarette in a football locker room. And I'm going to skip these quotes just for the purposes of time. And then, of course, there's this issue of accessibility. So this study on the left, youth who used Juul flavor pods in the past 30 days primarily obtained them from physical retail locations. And we've seen this in our studies as well. There's very low rates of compliance. You know, in our studies in California, this was a national one from Truth Initiative, where kids just are very, getting these products is not challenging. We asked participants in our qualitative survey how easy it was to get these products, and they generally said it was very, very easy to get them. On the top right, super easy. I was definitely underage when I bought it, but I just went to the local store by my high school that everyone went to, and I was like, "Can I get an e-cig?" And the store clerk was like, "Are you 18?" And I was like, "Yeah, but I don't have my driver's license," and he just let us buy it. Another participant in our study said, "I used Postmates to get e-cigarettes delivered to me." This was the first time that they had used it. The Postmates delivery lady did ask for my ID, and I said, "Oh, I don't have one." And she was just like, "Okay." This was a study not published by our team that looked at violation rates in California. And I won't go through all of the details here, but just wanted to comment on the fact that at tobacco and vape shops, 50% of young people between 18 and 20 who went in sting operations, the retailer did not check their identification, and 45% of young people were successfully able to purchase a vaping product from a tobacco or vape shop. So you can see here, I mean, there are a lot of issues with compliance and enforcement, even when we have strong policies. You know, if there's no enforcement, then we end up with data like this, where kids can just get whatever product they want. I talked briefly about price, just to give you a brief overview of price. When Juul came out, Juul cost, you know, buying a Juul device generally was somewhere between $15 to $40, depending on whether there were coupons or discounts. Then you had to buy the pods. We had a lot of reports from people that Juul was just a very, very expensive habit. And so as the products evolved, we now get these disposable products on the market like Puff Bar, where, you know, these disposable products are going for $5 or $6. They're cheap. Most young people can afford $5 or $6 or even $10 for a product. And there's really no risk to these things, because if they lose it, if it gets damaged, you know, they just go buy another one. It's not like they've invested, you know, a chunk of change into a vaping device. Targeted advertising has pretty much always played a role in tobacco initiation. The tobacco industry is known for it, and the e-cigarette industry is no different, and has been following, you know, pulling a page out of Big Tobacco's playbook. Lots of advertisements that really have been targeted to young people and to different populations, and really no oversight in terms of the advertisement. All right, so why do youth keep vaping? You know, many of the same reasons that we talked about already. They come in flavors, they're not expensive, they have high levels of nicotine that keep kids addicted. You know, and so we really wanted to kind of understand the answer to this question, whether there were certain characteristics of these products that might keep youth vaping, that could be good targets for regulation and policy change to alter those decisions. So we started with just a basic study where we asked people how important the following characteristics were to them. So we queried vapers, those who had vaped frequently, multiple times per week over the last month. And we asked them about 18 different characteristics related to the device and related to the e-liquid. For device, the most important things that people noted were device price, size, the hit that it provides, and the type of device. So whether it was a jewel or a disposable or something else. For e-liquid characteristics, the most important were flavor, price, and nicotine level. So one downside to this research is that this is essentially what the survey instrument looked like. So we had 18 different things. We asked participants for each of these different characteristics to rank somewhere between 0 and 100 on a visual analog scale. And this can be challenging after a while, and especially across 18 different product characteristics. And so we implemented a max-diff choice task as an alternative way to understand how important these 18 characteristics were. So max-diff choice task is a task that is often used in marketing research, and it's beneficial in that it has a lower cognitive load for participants. So they are tasked with choosing the most and the least important product characteristics from a smaller list. And they go through several iterations, but they're only comparing, 4 to 5 different characteristics at a time. And they just have to make one decision. What's the most important? What's the least important? From this, we get a lot of really good data. We get information on the relative importance of each of these products, both overall and for each individual. So this is what the task might look like. In this case, they had 5 characteristics that were provided, and they selected the most important as being price and the least important as being the device is new or popular. And they'll see a series of iterations and different characteristics will come up. And from this, you get a lot of information on the ranking and again, the relative importance of each of these. So similar findings from this, price of device, strength of the hit, and the type of the device were the most important things that came up for the device characteristics. And flavor, nicotine level, and price of the e-liquid were the most important things that came up for the e-liquids. In this same study, we also asked participants to give us a little bit more information on whether there are other things that are important to them. And these are the characteristics that showed up for device and e-liquid. So for device, the length of the battery, so how long the battery lasted, was the most important thing that came up a bunch, followed by flavor and price. And then for e-liquid, definitely flavor, followed by price, and then the nicotine level. We did a similar task looking at reasons for use. So we had a list of a bunch of different reasons to try and understand why young people use e-cigarettes. Again, with the idea of kind of taking that information and thinking about how it can be used in intervention strategies, prevention strategies, and possibly in developing regulation. So we had a list of a number of different reasons for use. We did the same thing where we asked people to tell us the most and least important reason why they use e-cigarettes. What we found overall, the most important reason for use was relaxation, followed by less harmful, then flavor, affordability, and cessation, or to quit using cigarettes. This was overall, but in looking at these data, we really started thinking about the fact that there were probably different groups of people who may be using for different reasons. And so we did a latent class analysis and found 4 different groups that really popped out. An experimentation group, these were people who just kind of ranked everything around the same. They a little bit more for like boredom and experimentation, ranked a little bit higher. The recreation group who reported mostly using it for relaxation, also because they were affordable, because they liked the flavors, and because they were less harmful. a dependence group who also ranked relaxation as the #1 reason, but because they couldn't stop using it, or dependence as the second most common reason. And then a cessation group, which ranked cessation and because they were, in order to quit smoking, cessation, and because they were less harmful as the top reasons why they use these products. All right, so we've talked a lot about why youth begin to use e-cigarettes, why they keep using e-cigarettes. And I think it's worth thinking about what are the adverse consequences associated with youth vaping? Like, why do we care that youth are using these products? Why does it matter? Are there any adverse consequences? So I'll talk through a couple of different studies that we've done looking at different adverse consequences associated with youth vaping. So we'll start with nicotine dependence. As I mentioned earlier, with these newer products, the level of nicotine that youth are exposed to is very, very high. And so there's a high risk of nicotine dependence because youth are using these products. They're flavored, they often contain cooling agents, and they're getting very high levels of nicotine without a lot of the aversive effects or the throat hit, you know, the internal thing that tells a young person to stop using this product because it's bad for them. In one study, we looked at the prevalence of e-cigarette dependence among young people and found that there was pretty high levels of dependence and that dependence was associated with future use, providing some validity to these updated measures that we used. In another study, we really tried to understand whether there were certain characteristics of the product that were more strongly associated with dependence. And I won't go into too many of the details, but we looked at the first device that participants used and the first flavor that they used, and found that using mint or menthol as a first flavor was associated with greater odds of reporting any nicotine dependence. And then that was also associated with higher levels of nicotine dependence relative to using a fruit or sweet flavor. And there were some mixed results by type of device. So while Juul was not associated with higher odds of report of any dependence relative to some of the other device types, it was associated with greater dependence within the group of participants who reported any dependence. In our qualitative studies, we also, had a lot of people report that they were struggling with dependence. I wish that this first participant, I wish that I was able to measure how much I was vaping. I have no idea how much nicotine I'm taking in. I really don't. I always have it, so I don't even really know how often I'm ripping it. And the second person, when I started vaping, I just found myself using it all the time. With the cigarettes, at least I'd have to go get myself up, go outside, light the cigarette, and then put it out and walk back in. It's a whole process. I could just be sitting there doing homework and I'm just vaping and I'm like, hold up, this is supposed to help me quit? Other participants said, and I'll run through these quotes, "It's crazy because we call fiending when you just really want to hit something and you can't. I really felt that a lot where I get irritable, like, damn, I really wish I had my vape right now. And there's this overwhelming satisfaction when you do hit it after a long day or you haven't hit it in a while. It's dangerous how good it feels." The worst thing is, like, first thing in the morning, it's under my pillow. This is my rock bottom. It's under my pillow when I sleep, so I can use it first thing in the morning. I think by the end of the semester, it became less of something I did to release stress because of the head buzzes, and it was just something I needed to do for a sense of normalcy. On the bottom quote, "I rip it so many times throughout the day that I'm scared to stop. My blood composition has got to have nicotine in it, like a lot of nicotine. I'm going to go through some sort of withdrawals if I try to cold turkey it or wean myself off of it less and less." We've also found similar concerns and stress about, being addicted to Juul. In a study that we did using data, we did an analysis of Twitter posts about Juul cessation. And some of the things that came out in this analysis were different people reporting publicly on social media different methods to quit smoking or to quit juuling. There were a lot of people who commented that they had used cigarettes to quit juuling. So one quote, "If you're looking for an affordable method to quit juuling, there's a new product called a cigarette containing 95% less nicotine than one Juul pod." And then, of course, unintentional quit methods: tip to quit juuling, drop it out of a speeding car, and some others. Participants also expressed a lot of difficulty quitting. Quitting Juul is easy. I've done it about 30 times. Currently trying to quit juuling for the 235,711th time. Wish me luck, I guess. And then reporting, feeling stressed out very early on. So Operation Quit Juuling is 7 minutes in and I'm already weak. This is a participant who, from our study, who said, "Vaping is something I've integrated into everything I do. There's posts on the internet that say, how do you know that you're addicted to vaping? And it's like vaping becomes a part of you. Like you look down and you realize it's in your hand. You don't even know." So there are other consequences associated with vaping beyond just nicotine dependence. I'll talk briefly about this transition to combustible products. So one of our participants said there's this weird pendulum push with a lot of people that I know, where they started with cigarettes, they went to Juul to help them get off of cigarettes, but they became way more addicted to nicotine with Juul, so now they're going back to cigarettes. And we've spent some time trying to understand whether vaping is associated with smoking and under what conditions that's actually happening. In a meta-analysis that we published in 2017 with the first 7 or so studies that came out, we found that those who had used e-cigarettes had 3.5 times the odds of subsequently beginning to smoke combustible cigarettes. You can see here that the odds ratios were significantly elevated in each of the studies. And these were just the first 7 studies that came out. Since then, there have been a lot of other studies that have come out across the world showing similar associations of e-cigarette use with cigarette initiation. We've also found that the frequency of smoking seems to be either similar or more frequent for vapers and non-vapers. So in this study, we compared never e-cigarette users and cigarette users, and we looked at what was happening a year later at follow-up. So in the red box here, the top is never e-cigarette users, bottom is ever e-cigarette users. And you can see that the risk of cigarette initiation, shown by the black pie piece, is greater for e-cigarette users versus never e-cigarette users. But once they begin to use these products, the distribution, or once they begin to smoke, the distribution of whether they are just experimenting, infrequently using, or frequently smoking looks pretty much the same for e-cigarette users compared to those who began smoking without using e-cigarettes first. In another study, we wanted to see whether there were certain product characteristics that may increase the frequency of cigarette smoking at follow-up. And so we looked at device level of nicotine, or whether there was nicotine in their product, and whether they had used their product for vaping. And what we found was that most of the difference in the association appeared to be due to the type of device that they were using. And once device and nicotine were in the model together, the association with use of nicotine and number of cigarettes smoked at follow-up was no longer significant, but remained significant for type of device. So use of a higher powered, more efficient nicotine delivery device, in this case we used mods as the comparison, was associated with smoking more cigarettes at follow-up. All right, and so switching directions again, another potential problem with youth vaping are the potential respiratory effects. So we've done a number of different studies on this. I'm going to just talk about just a handful of them today. So these are data from our qualitative study. Yeah, I try to quit vaping all the time. It's usually right before I go to bed after a long day of hitting my vape all day, and my lungs or my throat hurts and my chest hurts. And I'm thinking, I need to stop right now, just right now. So I'll go to bed and then I'll wake up and vape again. And another participant, it's really bad. I mean, when I get sick, like if I get a cold, I'll be sick for 3 weeks or like a month, as opposed to a few day thing. It always turns into something worse. And there's been many times, at least 2 or 3 times, that I've gotten pneumonia, bronchitis just from a cold. In a study that we did with collaborations at UCSF and at Yale, we combined data from a number of different studies, both across all of our centers. So in Connecticut, Northern California, Southern California, and 2 of our studies in Southern California. Overall, we looked at frequency of e-cigarette use and report of respiratory symptoms, and looked at bronchitis, asthma, and shortness of breath. In the gray box, or the red box at the bottom, these are the results for those who had vaped 6 to 30 days of the past 30 days versus those who had never vaped. We found significant effects for the odds of bronchitis, no significant effects overall for the odds of asthma, but then also significant effects for the odds of experiencing shortness of breath. And this was, again, a collaborative study. We had about 10,000 participants in this study overall. We've also looked at secondhand nicotine vaping. This is a study that's currently under review. And what we found here is that exposure to secondhand nicotine vaping, so this is living with somebody else in the house who vapes, either in the previous year, in the current year, or in both years, was associated with greater risk of bronchitic symptoms and shortness of breath. We saw some elevated estimates for wheeze, but they were not statistically significant. All right, so what can we do to protect our youth? We've talked a lot so far about vaping, what's happening with vaping, why kids vape, what are some of the consequences of vaping. So I think it's worth talking and spending a little bit of time thinking about what we can do to actually protect youth from many of these adverse consequences. There have been a lot of different policies that have been proposed in a number of different areas. Tobacco 21, as many of you are aware, I'm sure, was implemented recently across the United States, where the legal age for sale of tobacco products is 21. There are a lot of other options other policy options, which often happen more at a local or state level, that are not necessarily, implemented at a federal level yet. There are always licensing, zoning, retailer density options, increasing tobacco prices through non-tax approaches, different policies that can restrict product availability, packaging, and placement. Restrictions on tobacco advertising, which really there hasn't been much in the way of restriction of advertising for vaping products. And then there's also point of sale health warnings and some other things that can be done. In January of 2020, FDA finalized an enforcement policy on unauthorized flavored cartridge-based e-cigarettes that appeal to children, including fruit and mint. So this was a big win in terms of including the mint flavor in this enforcement policy. The unfortunate part about this is that this policy only applied to certain products like Juul. Products that are disposable products like the Puff Bar, the $5 product that's all-in-one, those are still available in flavors. And the sale of e-liquid solutions also still allowed in flavors, any flavors. California, sort of in response to this and just in the interest of sort of trying to get ahead of this problem with so many young people using these products, the governor signed a bill to ban flavored tobacco products, which happened in August of 2020. This was really exciting in California because the bill was totally comprehensive. So the bill prohibited the sale of any flavored tobacco products. So no more menthol cigarettes, no more flavored cigarillos, no more flavored e-cigarettes. Any tobacco product that came in a flavor was no longer going to be allowed under this bill. The plan was to get that implemented right away. And we were hoping near the end of 2020 to see that go into effect in 2020. However, there was a referendum filed to overturn the flavored tobacco ban. This was not surprisingly spearheaded by the tobacco industry, and they were successful in overturning the ban. And so the ban will now go to be voted on by people in the state of California at the next statewide election, which is not until November of 2022. So the earliest implementation of this will be December of 2022, more likely into 2023. It's worth showing you a very brief advertisement. This was one that came out before, while the government was still kind of considering this ban, but it's something that I think we're going to see more and more as many of these flavor bans are being considered, not only in California, but across the country.
Backroom deals with special favors for the rich. The flavored tobacco ban is politics at its worst. SB 793 criminalizes the sale of menthol cigarettes, the choice of Black and Latino smokers. But premium flavored cigars, hookah, and pipe tobacco stay legal, giving special treatment to the rich and singling out communities of color. Tell your assembly member to vote no on SB 793. It reeks of politics.
So with all of this, I've really been thinking a lot lately about new methods to really identify targets for regulation. And so I'm just going to present with my last few minutes, and then I'll stop for questions, some new things that we have coming up. So I have been developing a conjoint task that is really intended to kind of do a better job at figuring out what characteristics of e-cigarettes are appealing to young people and potentially less appealing to older people who are adult smokers aiming to quit smoking. So for example, if we find that flavors are important to everybody for sure. If we find that flavors are much more important to youth than they are to adult smokers trying to quit smoking, then that might be a good target for regulation. So with this conjoint task, this is a marketing tool that is often used in all of your standard marketing by all companies that do market research to try and find out what people like. And so we developed this task to really try and get at how important different characteristics are. So we varied a number of different things: flavor, nicotine type, whether it is synthetically produced nicotine or tobacco-derived nicotine, the level of nicotine, the warning label, and how big it was. So whether there was no warning label, whether it took up a third of the package or half the package, and then the pack imagery. So whether there's nothing, which is like what you see in the Zeus bar on the right, whether you have just sort of a characterizing image or whether you have a cartoon image, and in this case it's a Zeus who is holding whatever flavor it is, in that case on the left hand side, menthol. So we developed this product. Zeus bar doesn't exist. We worked with a graphic designer to put all these images together. And collectively, we had almost 900 different images across all of the different characteristics and the levels that get loaded into this program. So obviously, it would be very, very challenging for anybody to sit and click through 900 images and decide whether they like a product or not. And so this task really takes advantage of a factorial design, and it's adaptive. So it uses the information that people provide. If you keep saying, I would not buy a tobacco flavored product, it'll kick tobacco flavored product out of the task for that participant. And what you get on the back end is a lot of information about the relative importance of each of these characteristics. So this is an example of what the task looked like, what participants might see. And this is another iterative task. So they'll see usually about 3 to 8 different variations on this first part where they select whether they would or wouldn't buy. Every so often, they may see a message pop up saying, we noticed that you never selected tobacco flavor. Would you ever buy a tobacco flavor? And you can select, no, I would never buy a tobacco flavor. We also expanded this, our line of products from the disposable products into also an e-liquid solution. And you can see 2 examples here on the left-hand side, and then a jewel type product, which you can see here on the right-hand side. Again, varying all of these different things. So the flavor, the package design, whether it has a cartoon or just a regular image or nothing, the nicotine level, warning label size, etc. All right, so the evolution of nicotine products. So there was a teaser in the beginning, right, about these new products that are coming to market. One thing that's particularly caught my attention recently is the marketing of these products, synthetic nicotine products. So these products contain a new warning label that is not FDA approved that says this product contains tobacco-free nicotine. Nicotine is an addictive chemical. So the regular warning label for e-cigarettes is just this product contains nicotine. Nicotine is an addictive chemical. One concern with the marketing of these synthetic products is that the deeming regulation, which deems different products to be subject to the FDA, the Tobacco Control Act, has defined tobacco products as any product that is made or derived from tobacco. So when we think about these synthetic products, because they are in theory not made or derived from tobacco, may sort of escape regulation by the FDA Center for Tobacco Products. And thus would not be subject to a lot of the different things that FDA is trying to do to protect young people from using tobacco products. So one thing that we are doing to sort of test out the appeal of these products is to implement some of these within cohort experiments. We've done this with a few other characteristics that I haven't talked about here yet, or haven't talked about here, I won't talk about them here, where we take the cohort and randomize them to receive different stimuli. So participants will, this is just a draft, but participants will be assigned to see one or the other of these. On the left-hand side, this is just your regular e-cigarette product. On the right-hand side, this is your synthetic nicotine product. With Puff Bar, the products look very similar. We're going to take the Puff Bar brand off and just kind of make this into a general product. And we'll test the appeal of the different products. So tobacco-free versus just your regular e-cigarette. You can see here, these are 2 products. This is the old Puff Bar on the right-hand side and the new Puff Bar on the left-hand side. The old product just says this product contains nicotine. The new one in the warning label, this product contains tobacco-free nicotine. And so it'll be interesting to see whether participants experience any sort of difference in their perceptions of the product given these changes. Nicotine gums and lozenges are also something that is sort of making a comeback. Back in forever, I don't know when Nicorette became a thing, but Nicorette's been around for a long time, both their gums and their lozenges. But recently, other products like Lucy and Rogue, which are shown here on the right-hand side, have come to market where they are marketing the same product, nicotine gum or a nicotine lozenge or a nicotine tablet. And instead of having sort of your medicinal box and instead of going through kind of the approval as a nicotine cessation product, these gums and lozenges are just being marketed essentially as a tobacco product, given the warning labels that you can see here with these products. And they're also on the Lucy pack, although not in that particular image. And there are a lot of different products that are coming to market now. And so this is something else that I'm curious about. Like, I wonder whether these new nicotine products are going to be appealing to young people. They certainly look appealing. They look appealing to me. I think these products on the right-hand side look quite interesting. And so this may be, on the horizon of kids using products that we maybe need to be worried about. So this was a lot. I know I kind of aim to just give you a snippet of everything that, that we've been doing, that has been going on in terms of the e-cigarette market from the youth perspective, and the important research questions from my perspective. We've been doing a lot of work. We have a lot of different studies that are going on right now. And I'm happy to go into more detail on kind of any of the things that I've shared with you today, but just wanted to again, give a broad overview of everything e-cigarette related to young people. I can't end my presentation without giving many thanks and a great deal of appreciation to my amazing team of collaborators. I have been working with a lot of students who led many of the studies that I presented here today, and they are inspiring and really fun to work with. And so yeah, so with that, I will say thank you, and I will take any questions. And of course, if anyone wants to email me, please feel free to.
Thanks so much, Dr. Barrington Trimis. Sorry. Oh, we're getting some feedback here. Anyways, take some questions. There's some time. There's yes, there will be a recording available. We'll let you know when. I don't have the exact information, but and if you want to put questions in the chat, feel free.
I have a question.
Please.
Yeah,
Please.
I'm just wondering if you expect the pandemic and students being away from school and congregate settings to possibly be protective with vaping, or if you have any early indication of what you might think with that.
Yeah, that's a great question. So I didn't present any of our findings from COVID, but I have an administrative supplement to work up some of those findings. In what we've found is that we're seeing both. So there are some young people who, because of the pandemic, we're seeing just decreases in the frequency of use, complete cessation. And then for others, we're seeing initiation. We had, I think, about 20% of our sample initiated vaping during the pandemic sometime. So we surveyed young people before and after the start of the pandemic, kind of mid-pandemic, and found a substantial amount of initiation and also increases in use for some people. So it's kind of split, right? Some people decreasing in their use or quitting, other people increasing or starting, and I think a lot of that has to do with really how they were impacted and what their environment is like. Some people with the pandemic had parents home all the time. Other people, they were home, but their parents were not home. And of course, stress plays a very important role in all of this as well. So we are seeing that people who are experiencing any sort of food insecurity or economic instability, those were folks who were more likely to initiate, more likely to increase how much they were vaping, and less likely to quit.
There is a question in the chat box.
Yeah, great question. So the question is, what are protective factors to prevent the onset of use of e-cigarettes? So, you know, I think largely there haven't, I'm trying to think if there are like productive preventive factors that we could actually do something about. And I think most of the protective factors have been kind of, so, you know, they don't have friends who are using these products, or they just don't have access to the products, or like their parents don't vape, and so that's why they don't vape. And all of those are kind of, you know, prevention messaging, right? And sort of the interventions that happen in schools where we tell kids to, you know, maybe will have an impact on that. But really, I think a lot of the work has been in trying to walk back what's happened with e-cigarettes. So e-cigarettes came onto the market. They were totally unregulated. Nobody really knew anything about these products. And all of a sudden, they just took off in popularity. They were available in flavors, advertising was everywhere, and all of a sudden vaping just was a thing, right? And it was here. There were so many kids that were using these products. It became its own sort of culture. And at that point, you know, I think now it's, well, oh, okay, what can we do to sort of walk this back, right? What can we do now that e-cigarettes have become a thing, to change the culture so that it's not cool to vape, right? That's how we combated a lot of cigarette smoking. And in California, we have very low youth smoking rates. And a lot of that is because the culture is smoking is gross and smoking is not cool. I think we really need to try and do the same thing for vaping, but it's challenging because vaping is here.
Yeah, you know, it's fascinating. And as you were talking, and you were saying something a little bit more about the impact of COVID, I think that is going to be a fascinating sort of natural experiment, you know, in terms of, I assume it would limit accessibility, but then, and as well as the community at schools and things like that. But then if there are so many different experiences, it might be hard to really look at that. I noticed, I saw, for the first time, I saw a movie where I saw the main character vaping. And it was a little jarring. It was fun. I was just not used to it, but I don't know whether other people, I just may not see enough movies. Maybe it's more common, but it's that's sort of one of those things is, will it become standard if, oh, these popular movie characters are vaping? That could be a concern as well.
Definitely. And we know there's a strong association of exposure to smoking in the movies with actual smoking. And, you know, one thing that's kind of interesting about vaping in particular is that the substance that is being vaped is often not known, right? So if people are smoking a cigarette or they're smoking pot, you know what they're using, right? Oh, that person's smoked a cigarette or using pot. But with vaping, I found myself, I see vaping, and my question as a researcher is, oh, are they vaping nicotine, or are they vaping THC? And I think largely it's THC, but the fact that they look the same and you can't tell, besides other contextual clues, really sort of, you know, that's a whole other area of research, and one that we're really trying to investigate is whether we're going to see more of sort of the cross poly substance within the same product type patterns of behavior. And so it'll be interesting to track sort of what happens with tobacco and cannabis. And of course, the regulatory environments for tobacco and cannabis are very, very different also, and headed in opposite directions with more, with a movement toward looser regulations for cannabis and tighter regulations for tobacco. So it all makes for a very complicated field right now.
Sorry, we're almost at the end of the hour, so if there's any other questions, speak now or forever hold your peace. Or I'm sure Jessica would be willing to answer questions by email or anything like that. Again, I'd like to thank you for a really complete and comprehensive, and very interesting talk. I appreciate it.
Absolutely. Thank you guys for having me. And I look forward to chatting with many of you.